Hi, I'm Mercedes Stephenson, and this is the West Block, politics, perspectives, and players. This week, Armine Yalnizyan joins us to talk about women, the economy, and COVID-19. Armine, thanks so much for coming on the show.
My great pleasure, Mercedes.
You have coined two really interesting terms, and we've actually heard them come up in the government's language, in particular in the language of Deputy Prime Minister Chrystia Freeland. And those terms are the she-cession and a she-covery, instead of just the recession and the recovery. Can you tell us a bit about what these terms mean?
Well, historically, Mercedes, every recession has been a he-cession. The term was actually coined by the New York Times in the 2008 recession as something that happens all of the time. Mostly, in most recessions, more men than women lose jobs initially, and more women pick up the type of jobs that are available in the immediate recovery period, which tend to be lower paid. So historically, every he-cession is followed by a she-covery. This time, everything has been inverted. So the people that lost the most jobs as the economy was put into an induced coma to contain the contagion, mostly were women and low-paid workers. And the people who rebounded the most quickly were men with higher-paid jobs. So everything we know about recession has been turned on its head, just like most of what we're learning about the pandemic is making us rethink what we're doing.
What is it in particular about this pandemic and the economic consequences it's having downstream that is having this unusual disproportionate effect on women?
Well, it's partly because of the type of jobs that were deemed non-essential, the things that we could shut down to be able to contain the contagion. And so those tended to be in lower paid service jobs, in retail, in restaurants, in bars, in personal services like nail salons and hair salons, these and gyms and that sort of thing. All of these things were not declared not essential. And of course, we shut down the schools and childcare centers initially to contain the contagion. Now we're reopening everything. But childcare centers, unlike schools, are not publicly funded and delivered. And so a lot of these things that were market delivered, businesses are shuttering because of this strain of the pandemic's economic consequences, which is lower volume of business, therefore lower revenues, but higher costs. So we are losing childcare facilities that help people get back to work at a time where we're treating them still as a business. I like to use the comparison of, in Ontario, we're told that 40% of daycare centers are not reopening, according to the Minister of Education. If the Minister of Transport came out and said 40% of our roads and bridges weren't working, you'd have a plan because everybody would get it. You can't get to work, businesses can't get their supplies in, they can't get their shipments out. The economy would start to slow down, and in a major way. 40% is a huge block. It's a choke point for recovery. And mathematically speaking, if women don't get back into the game, because they were half the employed workforce before COVID hit, we just can't have a recovery. No, as I've been saying for months now, no recovery without a she-covery, no she-covery without childcare.
And so can you go a little bit more into that childcare and what's really needed to help women get back on their feet and back into the workforce?
Well, first of all, we can't just stand by and twiddle our thumbs while capacity shuts down. It is the choke point. If women can't have a safe place to put their kids, they can't get back to work. And just a moment's context here. Household spending is 57% of GDP. Household spending in every economy, China, US, and in European countries, is the biggest driver of GDP. And the biggest block of spenders in the economy are households with young children. So if you're going to take out some significant proportion of families' purchasing power, because moms make up 40% of household income amongst families with kids, then you're cobbling the economy. So without paying attention to the fact that you're standing by while critical infrastructure collapses and becomes a choke point to recovery, you're essentially, it's either policy incompetence or policy design, but something's like a failure to address the major choke point in the system. And that's why the throne speech was so important.
One of the questions that I have in the short term, and that a lot of women who were still working through this and were fortunate enough to keep their jobs found themselves caught between trying to care for their children, and not just young children, school-aged children as the school shut down too, and trying to telecommute at the same time. It's a lot to juggle. We're heading into a second wave. What is your advice to the government when it comes to schools and childcare? Should those stay open so that women can continue to work?
They can. What we need is a national protocol on what to do, because right now nobody knows what the rules are. And, we've had 6 months to figure this out. This isn't rocket science. We've got other nations that we can compare ourselves to and learn from, like Japan, like South Korea, like New Zealand, like France, like Denmark. There's plenty of examples on how you keep a system open, but keep it safe. But what we are failing to do is investing in quality childcare and making sure the schools, when they open, are safe to reopen in too many of our largest labor markets. So, the lessons are there to be drawn from, but for some reason we're not drawing on them. I think I can't really tell why that is, unless we are still kind of locked in a 20th century idea that, having kids is a personal choice, and deciding to go to work when you have kids is also a personal choice. Man, like, the economy functions, it is half held up by women. You cannot ignore the needs, the infrastructure needs of both men and women, and now our children. And that relies on quality, high quality childcare, which relies on a workforce that's also supported with training and decent working conditions. And the ability to take sick days, for heaven's sake. What are we waiting for?
I know that you wrote a memorandum titled Investing in Early Learning and Childcare to the Minister of Finance, the Prime Minister's office, and to the Privy Council office. What were your recommendations and your message to the government in there?
Well, the big pushback on childcare has been for decades, but jurisdiction. And the federal government's failure to play has been mostly because the cupboard is always bare. Why is the cupboard always bare? Because every time we have extra money, we give it back in tax cuts. Okay. We now have got a pandemic reality that says we have to spend more. We have to spend more, and a lot more. And the memo that I wrote says the federal government can play by picking up its pace in terms of being a true partner with the provinces that have been doing all the heavy lifting on early learning and childcare thus far. And any additional money that goes through has to be buying change, has to be invested in how we close gaps in access to great quality early learning and childcare, how we invest in training of all early learning educators so that every child has got somebody that knows how to maximize their potential around them, that they're not being warehoused, and that we're treating these workers better than zookeepers. 50 years ago, we were talking about childcare providers get paid less than zookeepers, given how much like a zoo a lot of childcare centers and classrooms must be today. They should at least get paid that well and also be trained to do the job properly. So we know how to buy, change, and build a system. But the threat is there that all we will do is pour money into the status quo, which is a market-driven system that fails far too many families. And we can do better with the money that could be flowing from the federal government if it's tied to conditions and outcomes.
Has the government given you any sense of a timeline on when they might move on childcare? Because one of the criticisms that we've heard, in particular from the NDP, is that's great, they're talking about childcare. We've heard promises about childcare before. This one, given, much more specific in the throne speech. But do you have any sense of how quickly or slowly this might unfold?
No.
Well, that's two of us then.
I have no idea. I have no idea. They know it's urgent. They've been talking about the problem as urgent. How quickly they will move, I have no idea. But, I fear that the first part of the problem, job one, is to stabilize the cratering of the marketplace. If we're going to be building a system and COVID is blitzkrieging the capacity to deliver, something has to be done, and immediately, on stabilizing what we have. And there, the provinces in whose jurisdiction this lies have been standing by idly saying, give us more money for healthcare. It's like, yeah, okay, but what about stabilizing what you've got on childcare, or else people can't get back to work? It's incomprehensible to me, Mercedes. I don't know who's going to move when and whether it's enough but too late to actually stabilize the system to keep people who are working now working and get more people who are offered jobs into the market because they can trust that they've got a good place to leave their kids.
One last question for you. You talked about other countries that have childcare systems. One of the big sort of criticisms and concerns in Canada has been, how do you have a childcare system that doesn't break the bank? When you look at other countries, what's the model for a childcare system that is affordable from a government perspective?
Oh my God, thank you for asking me that question, because it is the easiest question to answer of any of them, which is that it literally pays for itself. We have evidence from Canada on what happened in Quebec. For every $100 in subsidized care in Quebec, the Quebec government got $104 in new provincial income taxes, and the federal government, which didn't put in one thin dime into this program, got a windfall of $43 extra per $100 Quebec government spent. We have got a quarter of a century of research showing that if you invest in kids with high quality early learning, you reap the benefits for their entire lifetime. They maximize their learning and their earning potential, and we maximize our returns to the public coffers. Like, it's a no-brainer. I don't know why we haven't done it till now. The only argument for me is that it's been a culture war, that this is about mommy and daddy's choices, and governments don't interfere with choices, but we are now completely reliant on all hands on deck, and population aging will guarantee that women will have to stay in the labor market to stabilize household incomes and to contribute to GDP. We have got to act, and bonus, surprise, it pays for itself. Let's do it.
Armine, I love your passion and your knowledge. Thank you so much for joining us. We really appreciate it.
Thank you, Mercedes.
And thank you for joining us this week on the West Block Politics, Perspectives, and Players. We'll see you next week.